So the age-friendly health system movement started about 4 years ago, launched by the John A. Hartford Foundation and the Institute for Healthcare Improvement, which I'm sure some of our viewers have heard of. So what these two groups realized was care for seniors is not in America what it should be, and they wanted to focus on making it better. And experts in geriatrics came up with the 4 M's as the framework for helping us do that. So the what matters M, which we call our stretch M because it starts with a W, but you have the matters piece of that, which qualifies it as an M. The what matters is really the most important M. That is to understand not just what's on a patient's advanced directives or certain paper documents that we fill towards the end of a senior's life, but actually what is most important to them. What do they value? What do they enjoy? What are they afraid of? What gives them quality of life? So rarely in medicine do we really delve into those conversations the way we should. And what this movement has taught us is that this is probably the most important thing that we can do for a senior as a primary care provider is to have a conversation about what matters to them. Because if we do, then we're much more likely to give them the care that is tailored to those values and the care that they want, as opposed to the care they may not want. So that's what matters. The M of medication is the M that focuses on obviously medications, but medications is really important for seniors because by and large, they're on too many. And we tend to just start medicines and as they get older, either not stop them or not change the dose. And so they're much more vulnerable as people age to having side effects, to even having hospitalizations and harmful things happen. So the M of medication is focused on taking away medicines and reducing doses and making their quality of life better as a result. The M of mentation focuses on some conditions more common in our seniors, such as dementia, which is when the brain doesn't work as well as it should, Alzheimer's and dementia from strokes being the most common, but also on depression, anxiety, conditions we commonly see in older adults. And all three of those conditions under mentation, seniors may not volunteer to us that they're struggling with changes in their brain. And it's important for us as clinicians to look for those conditions and to ask about them. The last M is mobility. And really what that focuses on is function, the individual's ability to be independent. It's way bigger than your risk of falling, which is generally where we go when we think of mobility, but really it's about how can I stay as independent as long as possible and how can my healthcare providers help me? So those are the 4 M's. And what we know is that those 4 M's are way more important and way more pertinent to the care of seniors, especially over 75 and 80, than for our middle-aged adults. And so you're age-friendly as a health system if every time you encounter a senior, whether it's in the clinic or the hospital or the emergency room or in a rehab facility, that you're looking after all 4 of those M's.